I'm Nuno. I'm an associate professor in the Department of Biostatistics and an associate professor in residence in the Department of Surgery here at UC Davis School of Medicine. My interest research lies at the interface of biostatistics, health services research, and surgical outcomes research. My role in the Department of Surgery is to facilitate collaborative research by supporting faculty in the specialties of cardiothoracic, trauma, vascular, and other surgical areas of expertise. I provide statistical support for many long-ranging collaborative projects in health services research and outcomes research, as well as basic clinical research. I work very closely with investigators to prepare grants or to educate via seminars and teaching in biostatistics, as well as to mentor students, graduate students. My research aims to identify the best evidence to guide personalized patient-centered care, to develop new health outcome metrics, and improve methods for studying surgery outcomes. Ultimately, at the end of the day, we want to translate this research into practice. By collaborating closely with surgeons, primary care providers, and emergency medicine and trauma physicians, our goal is to improve outcomes in patients undergoing surgery. We hope to improve short-term outcomes such as mortality, length of stay, and preoperative complications, but we also care about improving long-term outcomes such as overall survival and the quality of life of patients. I am particularly interested in studying outcomes in pediatric trauma care. Trauma is the leading cause of long-term disability and death in children. Some of my recent research involves the study of abusive head trauma in children younger than 2 years of age. Abusive head trauma occurs most often during the first year of a child's life, with an incidence of 20 to 30 cases per 100,000 population. It is the most common cause of lethal physical injury, and as many as 30% of these children may be diagnosed at initial evaluation, making early identification a critical life-saving process. In a recent study of 5,000 infants diagnosed with abusive head trauma in hospitals throughout the United States, we found that abusive head trauma injuries are strongly correlated with infants' inconsolable crying. The highest incidence of abusive head trauma was documented in kids of 2 months of age. Furthermore, we found about 11% of these children die within the hospitalization and spend an average of 10 days in this hospitalization among those that survive. Younger infants with poor household income and concurrent injuries of retinal hemorrhage had an increased risk of mortality. Children with abusive head trauma experience very high mortality among survivors of this injury. However, very little is known about long-term outcomes for these patients. Our ultimate goal here is to not only prevent these injuries, but we also want to figure out ways in which these kids that have already been injured can improve in terms of their outcomes. And some of the recent efforts that we're conducting in terms of studies is to try to understand what is the impact of abusive head trauma long after the initial injury.